Hi, everybody. Today I wanted to talk to you about a topic that frequently comes up for an internist on a day-to-day basis, and that is asking and being asked for consults. So let's start with asking for a consult. There are two main things that I want to focus on here. Number one is you really have to do the work. You don't want to be dumping your work on another specialist. However, I will point out here to some of us who are a bit hypercritical about ourselves, some days as a general internist, you will be really busy. You will have a lot of patients. Some patients will be crashing. And you know this other patient needs a consult for something else, but you really haven't had a chance to really dig your teeth in yet. But in that situation, it is not really appropriate for you to do that. Just ask for a consult and move on. The main point is you don't want to make that your pattern when you have the time and the energy to do that. Number two is it is not about you. And I'm telling you this because I've had to tell myself so many times. So when you notice yourself having a little buzz of something like resistance, hesitance, worry about getting a more specialized opinion, it typically is because there is a low buzz of thoughts that sound something along the lines of, I probably should know this, or they're probably busy. They're going to think I don't know what I'm doing. So notice it typically is because of thoughts that sound more self-judgmental, and it has more to do with what you're worried about the other person is going to think about you. So when you notice yourself thinking that, I want you to gently redirect your brain without major self-judgment, just to the question of what is the best case scenario for the patient? What is the best that I can deliver in this case to my patient? And it doesn't necessarily mean a more specialized opinion. Sometimes getting a more specialized opinion causes delays and more adverse effects. So it does not always translate to that, but you want to be clear about your question and the intention. Now, let's move on to the response you're going to get on the receiving end. And that will be variable. Again, I want to remind you, it has nothing to do with you. 100% of the time, no matter what kind of response you're going to receive, it has nothing to do with you. It has everything to do with the emotional drama that person is going through on their own end. They may be busy with consults. They may have crashing patients. They may have personal issues that they're going through, and that is okay. And in truth, your question may be a little weak. Maybe you should have known that. It doesn't matter. The person on the receiving end has a choice between responding with more educational information so you know for next time, or they have a choice of really lashing out at you and doing whatever they want to do. Leave them to their thoughts. Don't get in the pool with their emotional drama. Just ask for their opinion and move on with your day. Okay, let's talk about being on the other side of the consult drama. So let's talk about when you are the one being asked for consults. The main thing I want to point out here is you need to stay focused and present. And it's easy to say that when you come into work, you have your first consult, you listen, you pay attention, you have the day, you're excited. But it's much harder to do around 5 or 6 p.m. or at nighttime when you're getting bombarded with consults, when you're constantly getting called, when patients are getting sick, and you're getting pulled into a million directions. What you will find is that you start having a low buzz of thoughts that sound something like, I still haven't had a chance to really dig into my teeth into this patient, and this patient is not doing well, and I still haven't gone through these first 10 consults that I received. And you then project your thoughts about that onto all the rest of the consults. So when you're receiving consults at around 5 or 6 p.m., you still need to stay focused and present. If you have somebody who's crashing, just ask the consultant to call you back. There's no issue with that. But if you're just being busy with your own thoughts about it and thinking about how busy you are, not helpful. Move them out. Move them out and try to really bring it back to the current situation, to the present moment. And that is all I wanted to touch base at today. I am very excited that you were able to join me for a few minutes. I am really interested to find out what your thoughts about this are and what you have found helpful in these situations. Thank you so much for being here. Bye.